It is an honor to have Dr. Wantanee Kalpravidh as a moderator and speaker for this morning session. Dr. Wantanee is a regional manager of the FAO Regional Office for Asia and the Pacific in Thailand. So now I introduce you and invite Dr. Wantanee on the stage. And I will turn over to Dr. Wantanee to introduce our speaker today. Dr. Wantanee, please. Speaker, I would like to introduce you to be on stage with Dr. Wantanee too. Please.
Good morning, everyone. Yes, we are waiting for all the speakers to come up on the stage. Wow. I think perhaps the participants had very good night last night, or they are trying to get ready for the field trip today. For those people who sit in the back, would you like to come up to the front so you can see how handsome and how beautiful our speakers are? Okay, as we do not have so many people today, let's make this panel discussion more informal. And you know, these gentlemen, you can even relax, be more relaxed. You don't have tie anyway. Yeah, you can take your jacket off. Okay, for this session, the title is the One Health Opportunity and Network. As you know, I think this is under the TEPHINET. What we would like to do is try to discuss the One Health network and the opportunity under the field epidemiology training program like. And as you all know, the FETP program has been established perhaps about 40 years, I believe, and almost 40 years. And the program has been doing quite well in strengthening the capacity of the human health sector. And we have seen the medical doctors, the human health sector, working in the field and making contribution to prepare and also respond to any public health threats. You have also to agree with me that in the past 20 years, we have seen so many events. For example, Nipah virus infection occurred in Malaysia, Hendra virus infection in Australia, SARS, avian influenza in the past 10 years at least, and MERS, and there will be more. These diseases are the emerging infectious diseases with the zoonotic nature. That means we need the involvement of other health sector. And then the One Health approach has been embraced by the global community, as well as the regional and also the country level. And part of that, we have seen the establishment of the capacity building program for other health sector, for example, veterinarian and also the wildlife health. So today, I think it's very, very good opportunity to bring together the two key programs, FETP-like programs in two countries, Thailand on my left and China on my right here. Before we proceed with this talk, again, it's going to be informal talk, and you can interrupt me anytime. And just only thing, you cannot have any dirty joke here. It's not allowed, but you can do so when you go on the field trip, okay? And another thing that I've seen is, comparing to the session yesterday, today we have quite a well gender balance. Just for the organizer to record, we have kind of very well balanced for the gender. So I would like to introduce the beautiful ladies next to me first. On my left here, Dr. Chuleeporn. Would you like to briefly introduce yourself and also tell the audience on your position at the moment? Briefly introduce yourself.
Okay. So I'm Chulee, and I think many people here know me. I just involved in FETP almost 30 years, and that is my brief history. FETP Thailand.
30 years. Wow, you look so young. And also, Miss Kang here, yes?
Okay, thank you, Wantanee. My name is Kang Jingli. I think many people knew me, the new faces here. And I worked in the China Animal Health and Epidemiology Center. And I'm in charge of the China FETPV programs almost 7 years.
7 years, wow. Okay, then we move on to the next gentleman, please.
Okay, morning everyone. I'm Dr. Guoqing from Chinese Field Epidemiology Training Program. I graduated at 2005 when I joined FTP in 2003 when the SARS outbreak occurred in China. So after graduating, stayed in the CIPTP, worked for over 10 years. 11 years, I think. Thanks very much.
Okay, we have quite good person for that have the experience on the disease like SARS related to One Health as well. Okay, now move to Dr. Karun. Yes, please.
Good morning, everyone. My name is Karun Chanachai. I'm the director of the FETP Veterinarians in Thailand, and I had ever been trained in FETP program Thailand for more than 10 years, since 2004, yes, which is 13 years already. And after graduate from the FETP program, after that I involved more and more with the FETP program.
Good, thank you. And Dr. Barrett.
Good morning. My name is Boripat. I'm a veterinarian by training. I and Karun, we are classmates. We graduated 22 years ago. And I have had my career in the wildlife sector since then. So that's the only specialties I do.
Thank you very much. So you have seen we have 2 medical doctors, we have 3 veterinarians, and one among the vet is the wildlife specialist. So what we would like to know today, all of them involved somehow on the field epidemiology training program. And we would like to hear more on how the program that they are running look like. What I'd like to know, all of you, and for the audience, assuming that I'm the young veterinarian, just graduated a few years ago. From very far, you might see that I might be young. And I have been assigned to be responsible on the One Health related activities. I'm looking for a program that I can build my capacities. I do not have lots of time to take leave and go for the master degree program. I'm looking into the program that can provide me with the field experience as well. So let's say, can you sell your program in 3 minutes? You're allowed to use only 1 slide, and I'm going to control the slide. Okay, so after 3 minutes, I change slides. Is that okay? No, I'm not that mean. I'm not that mean. I'm interested to know the program as well, okay? So please use these 3 minutes to convince me if your program would be good for the One Health related as well, okay? Can I have slides? Okay.
Okay, so for FETP Thailand, Dr. Wantanee, if you come to our program, I can assure you that you have a lot of fun for the whole 2 years. That is during you are in the program, and when you graduate, it will be very useful both for your country and for yourself. For me, I learned a lot how to think critically, how to do reasoning, and in terms of the funding, you get to travel all over Thailand and also to the international. And not only travels, you will get to be in the real situation in country crisis. For example, Zika outbreaks, avian influenza, or major disaster like the big flooding. The program provide you all means and tools for you to understand how to apply epidemiology to solve a public health problem. And we also provide you the opportunity to have the real practice in the field. For the two years that you'll be with us, you'll be assigned as the national authority in disease control and outbreak response. We prepare team for you, budget, laboratory tests, and consultants. So I get her now, not the China program.
Wow.
And the way our curriculum construct, you will learn, bit by bit. During the first year, you have more than 10 outbreak investigation that you'll be involved. And also on the second year, you will conduct an epi study of your interest with support from the national levels all the way to the local levels. And we have alumni in policy level also in the Ministry of Public Health, of course, Ministry of Science and Technology, Ministry of Agriculture and Cooperative, Ministry of Defense, Ministry of Education, US CDC, and the WHO, and a lot more. So lastly, how the One Health can be integrated in our program. We work very closely with the FETPV, that is from the DLD, the Department of Livestock. We have field work together, the surveillance evaluation, and also the outbreak demonstration investigation. And also we have 3 or 4 workshops together, starting from the introductory course. We learn together and also play table tennis together too.
Wow.
Yeah.
Let's go.
Okay, so that's all from our program.
Okay, wow, that's very good, very convincing in 3 minutes. And you touch a bit on the multidisciplinary and also the involvement of other sectors, right? Okay, then why don't we move to another program in Thailand here by Dr. Karun. And you can also walk to see the bigger screen over there. Yes.
Yes, thank you very much, Dr. Wantanee. And Dr. Wantanee give me pleasure to put everything in one slide, and also maybe similar feeling with others speakers also in this stage. My course is named Field Epidemiology Training Program for Veterinarians, and that is we accept animal health worker, including veterinarians, and our program is already organized about 10 years. And when you engage in our program, you will learn how to apply epidemiology in the public health response. When I say public health response, it's not just only human health response. I also include the human health response, animal health response in the system, in our training. And also when you engage in our program, you will have an opportunity to be trained when we organize the training, we organize together. So you can be trained in multi-sectoral training program in both in the in-class training, and we also organize some joint field training also, some, for example, outbreak investigation. And also we are looking in the future to seek an opportunity to strengthen how we collaborate with the FETP program. FETP program is our master program. And in the future, we are looking for opportunity to strengthen in that area also. And last thing is when you engage in our program, you will have an opportunity to learn and to train on the surveillance, on outbreak investigation, and on the field study, which is we have the similar philosophy with our master program, FETP program. The philosophy is training by providing services. You will be trained, and then after be trained, you will go back to your own organization to provide the services, and also you have an opportunity to apply your knowledge, and then you will be learned by providing services. And after finish the training program, hopefully you will realize that the more you know, the more you recognize that you don't know many things. When you're dealing with other professionals, there will be other areas that may recognize you that you don't know many things. That is.
Wow, okay, thank you. I start to be convinced by the two programs already. Let's see, the new kid on the block for the wildlife. Perhaps the program is quite young as you. Just graduated 2 years ago, right?
Yes, indeed. Thank you, Dr. Wantanee. I'm very happy to share the stage because the wildlife sector for us is very challenging to have some program that similar to FETP or FETPV simply because we do not have enough trainers. The wildlife and ecology field that I try to represent and advocate for, there's very high diversity. It's not only the wildlife that we are focusing on. We are focusing on ecological health, the health of ecosystems, which we need to engage professors in forestry and environmental science, toxicology, and all kinds of wildlife species, because the outbreaks can occur in the fish in the ocean, in the river. The outbreak can take place in the village with birds and mammals and everything else. So in order for us to have similar course, it's going to take many more years. So we are now playing two roles. We incorporated in the FETP and FETPV program. They can invite the staff and experts in the wildlife and ecology sector to provide some perspective introductory lectures for the 2 years training course or for the 1 month course that they both organized. The second role we are trying to play is to develop a kind of a short module that could be a 2 days module. Upon request, we can design the program. The participants, either medical doctors, veterinarians, or livestock veterinarians, can also come to the wildlife sector, such as my own zoo or the Department of National Parks facility, and learn about the wildlife health issues, and also the interface between wildlife and human, and then the interface between wildlife and the people. And we also develop with the FAO and CDC and Mahidol University, we try to develop a 1 week module. We have done that with the China FETP before in the past. And let's plug that 1 week wildlife course into the 2 years course. And we have the longest course right now is about the 2 weeks training course, developing with the FAO called Wildlife Investigation on Livestock Disease and Public Health, an introductory course on One Health. That has been delivered in Bangladesh. The 3 courses have been conducted in Vietnam. We are trying to do the 4th course this year. So these are the kind of things that we are trying to do in the incubation period We are still under development. We are not trying to have a separate 2-year training program because in the past, the wildlife professional already enrolled in the FETP program, graduated 2 or 3 of them already, but the number is not enough. According to the slide I show you, the gap of the sectoral capacity, the wildlife sector, it's like a handicapped. In Thailand, we have over 1 million people in the Human Health and Public Health Task Force in terms of the Surveillance Rapid Response Team. In the livestock department, there are also tens of thousands, if not hundreds of thousands, staff in their systems. But if something happened to the wildlife in the wild, we don't even know who are the first responder, who they report the information to, what agency would be conducting the response mechanisms. So we are still trying to figure out, because the wildlife is always falling into jurisdiction cracks. If it's a fish, maybe the Department of Fisheries have to take action. But right now, maybe they're not aware. If the outbreak happens in the wild cattle, in the tigers in the forest, maybe the National Park Department have to take the action. But if something like this happens in the village, in the zoos, you know, we have to really figure out who is going to do what. So we still have a long road to go, but it's a fun road to walk because we need to really leverage up the sectoral capacity, and we really need help. That's why we are trying to work hand in hand with the FETP medical and also FETP veterinary.
Thank you.
And we also have a lot of fun working with wildlife.
Oh, okay. Wow, 3 programs already. Even though lots of travel, but you know, I'm still interested to go to China. Okay, let's see, Dr. Xu, how can you convince me?
Thanks very much, Dr. Wantanee. In order to convince you to join China FTP, there are main 2 points I want to emphasize. First, join CFTP means you join the network, the big family, because since we developed in 2001, we already recruited over 400 trainings. There are 288 graduates, 248 from our 2-year program. If you're interested in the 2-year program, you can join our CFTP 2 program. We also have 40 graduates from the newly developed Western program, specific for Western part of China. It's a 9-month program. There are already 40 graduates, so you have a lot of graduates can help you if you join China FETP. But remember, it's not easy. You have to compete with others from around the country. We have a lot of applicants every year. That's one point I want to emphasize. Second, join China FETP means you can become a very good epidemiologist, not only in animal health, but also in human health. You will have a lot of opportunity to work in the field. We already did over 2,000 field work in China FTP. Last year, we have 124 outbreaks. You have many opportunities to work in the field. You will increase your experience in the field. Also, we have a lot of zoonosis cases in China. In 2006, we have a lot of cases, brucellosis, human cases, rabies, anthrax, a lot of zoonosis outbreak. You can have the opportunity. We need more people to do the field outbreak investigation. Meanwhile, while you work in the field, you can get a lot of help from our mentor team, because we have a very big mentor team also. We recruit a lot of mentors from different parts of China CDC, also from some provincial CDC. So when you work in the field, you can get a lot of help immediately. So this 2 points I want to convince you. But if you join our team, you will be the first one. Okay, welcome to join FTP.
Wow, okay. I'm going to China next week. Let's hear another one, another program. Dr. Kang, the China FETPV. Yes.
Well, I make a bag from the Wantanee. Before sell my programs, I want to sell my team member, okay. Just sitting over there with a blue shirt. Say hello with everyone. Yeah. As you know, this is the first time the TEPHINET board of the meetings invite veterinary FETP programs to join this annual conference. So we feel very honorable at this time with our delegates. CFETPV means China Field Epidemiology Training Programs for Veterinarians. It is established in 2010 and with a great support from FAO and China MOA. Now it is implemented by the KAHEC, my institute, China Animal Health and Epidemiology Center. CFETPV has 7 years old, so comparing with other FETP program and the regional FETPV programs, we're still a young baby, I think. So we have a long march to go, and extremely welcome you to join us and help us and support us. CFETPV is the in-service training programs and use the learning by doing philosophies. I think it's the same with other FETP programs. But it is different from others is we formed 1+5 training framework. One means 2-year cohort training, same like the CFETP. 5 refers to training for executives, training for university academics, One Health, TOT training, and rollout training. So I will introduce the step by step. For 2-year cohort training, we just focus on the conventional veterinary epidemiology techniques. We want to improve their epidemic skills in the field. Until now, we have already finished 4 cohorts with a total number of 81 graduates. And in this training, we just formed 5 modules in each cohort. And 18% of this training we taught in English, and 18% is covered with field practice. And for training for executives, we just focus on the senior staffs in the veterinary service and veterinary authorities. And we just want to improve the senior staff's epidemiology thinking through their work of the animal disease prevention and control. Another one important training is One Health. We just work closely with the Guoqing CFETP programs in China. And we just initiate the joint course training regularly, year by year. And we encourage the trainees to work together in the field when they go back to their institute. So we just try to address the One Health dimensions through our training. Yeah. In addition, training for university academics, training for trainers, and rollout training in provincial levels are all also our important fundamental training modules. So I think CFETPV is your good choice, and we are waiting here for you.
Wow, quite well information. Very good information from all of you. I still cannot decide. I have another question, particularly to maybe the 3 first. We heard already that both FETP also accept vet. There is also multidisciplinary approach in that program. Then I'm wondering, why do we still need a separate program for veterinarian? Why do we have a separate FETP V? Let's say the V version. Why don't Dr. Karun first, and then I'll come back to Dr. Kang and ask Dr. Boripat. Yes.
Okay, thank you, Dr. Wantanee. And that is a very good question. And that would be a question that many of persons in this room may have the same question, why we need FETP specific for veterinarians. More than 10 years, I had a good opportunity to be trained in FETP program. And one of the most important things that I learned from FETP program is I learned to change my mindset when I dealing with the disease surveillance outbreak, and also even conducting the field study, because the FETP program Thailand, they have very good training program. It's a very good training program. I learned a lot during my training. However, they are, when I graduate from the training program, we discussed with FETP program to maybe we may need something, some training program that's specific for veterinarians. I mean field epidemiology training program. The reason is the concept of the field epidemiology is the same. When you apply the concept for public health, for animal health, for wildlife health, it is the same. And we, as the government officer, our mandate is we provide surveillance in animal disease. We provide outbreak response if there are any outbreak of animal disease occur. However, when we would like to apply field epidemiology to the animal disease or animal, it needs some special knowledge and experiences if we would like to do it in an effective way. I mean, if I work as the staff in animal health sector, I can give you examples. When we deal with the human health and human disease, a persons, it is individual persons. But when we are talking about the animals, we always dealing with a group of animals, a herd, a flock, which may be a flock of poultry which contain 10,000 of birds inside their farms. It may be a herd of cattle which contain 100 of cattle in their farms. How we get the information, how we know that any flock or any herd is infected or non-infected, we need some special approach. And also our infrastructure, animal health sector, we have limited infrastructure comparing the public health system. We don't have the primary health care unit. We don't have the tertiary health care unit. Because we have limited infrastructure, when we get the information from any event, abnormal event, we cannot much rely on the passive surveillance. We have to introduce some other tool of surveillance, for example, the active surveillance, which mostly rely on the sampling strategy. So that is needs some special knowledge and experience to apply field epidemiology in the area of animal disease. That is what I would like to emphasize. And when we organize the training program, there are two objectives when we organize the training program. The first objective is we would like to strengthen our veterinary services. And the second objective, we still would like to strengthen our network with the public health sector. And that is the two main objectives when we organize the program. Thank you.
Wow, okay, thank you very much. Now turn to Dr. Kang. When China Ministry of Agriculture decide to set up the China FETPV program, is that the same concept or what's behind the idea? Yes.
Okay, thank you, Wantanee. I think there are many epidemiologists sitting among us. So I think if you are the epidemiologist, you must know statistics. And you know, if you give us some serious numbers and the fingers can be convinced this, it is true, I think. And I just think CFETPV, just a veterinary epidemiologist, is not only good for the zoonosis control and the public health, but also it is served as a livestock development because it is a benefit for the food safety, food security, and livelihood. So I will give the reasons why CFETPV is developed in China. For the reason of food security, I just for the example, China has a large populations and livestock productions in the world. I just calculate, we just produced, let me check, 11 billion poultries, and 700 million pigs, 500 million cattle, and 300 million sheep in each year, in average. And these productions just feed the 20% of the population in the world, 1.3 billion people in China. So in China, we need the veterinary epidemiologist. This is the first reason. And the second one is for the food safety. The consumptions of the livestock productions is sharply increased during these years. And the the public want much better and safer food than ever before. So from this reason, I think we need the veterinary epidemiologist in China. And the third reason is from the livelihood. 18 million people is worked in the livestock development industries. And some of them, most of them are smallholders. So there has a risk. So in China, we have the need to employ and train most veterinary epidemiologists. So from about 3 reasons and factors, I think CFETPV programs is still needed in China. And we want the epidemiologists from the veterinarians to get the quick response to the animal health threat. Yeah, this is my reason.
Oh, okay, thank you, thank you. Now I turn to the wildlife sector. You mentioned a bit, and yeah, anything else to add?
First of all, I have to admit, speaking on behalf of the wildlife and ecological health sector, the challenge is way too high. First of all, we are about 50 years behind FETP program. We have almost next to nothing. Human health, 1 species. Food, animal, maybe few species. The wildlife is the rest of it. The challenge is very high. Secondly, even though we benefit from the FETP program, we have already sent the wildlife professionals to be trained in the 1-month module and also the 2 years program. But we already have graduated 3 graduates in 3 years. Average is 1 graduate per year. It's not enough to keep up with the work. The reason we have to develop our own program is to increase because the seats are very limited in the 2 years program. If we wanted to target 5, 15, 50 graduates per year, we have to come up with alternative platform. It could be a 1 to 2 weeks modules that we can train or educate or advocate more participants in our own sector. Because it's not only veterinarians. As I explained before, imagine, you can imagine MERS corona is involved camels. Nipah virus is involved fruit bats. There's a whole lot more pathogens that could be potentially a zoonotic disease or pandemics. It's involved wildlife species. For our sector, we want it to be mostly well prepared. We cannot wait until international agencies coming to us and tell you, hey, let's train to catch these species because it carries pathogens that can make people sick and die. We have to be prepared. We have to prepare the snake guys and the frog guys and the bird guys and the mammal guys in order to be able to restrain, capture, taking samples humanely. We cannot just kill everything and send the sample to the lab. It's also animal cruelty laws and animal welfare principles that many other sectors may not be aware of. So these are a couple of limitations and challenges that drive us to branch off from the main program and try to focus on how do we actually address these issues. The challenge, I have to tell you, is bridging the biodiversity sector and the health sectors. The health professional is likely to assume that the rest of the world need to understand your language. But people who study bats, people who study king cobras, people who study elephants, they may not be aware of the word attack rates or the R programs and things like that. They have their own terminology, but do we really actually reach out to them and try to understand their language as well? So this bridge is very, very long. The gap is very, very big. So we are trying to run every once in a while a biodiversity and health forums that we invite the ad hoc participants, and we try to initiate the dialogues from landscape change, pathogens, disease transmission ecology, interface issues and health issues, trying to blend the biodiversity people who never worked with a health professional before, trying to convince them, hey, let's help us because you are expert in catching bats, you study bat genetics and sonar and flight and everything, but there are a lot of pathogens that bat carries. So I think these are the reasons that we try to establish our own group, trying to address for the better outputs and outcomes.
Wow, thank you. Now I'll turn the question or giving the opportunity to the two FETP programs to talk. But taking the answer from Dr. Kang, Dr. Karun, Dr. Boripat, if I understand correctly, each of these sectors require their own specialist. And the nature, even though it's going to be the same concept of epidemiology, but there are more in details for animal health sector. That may be the animal diseases or animal productivities, and also the biodiversity, the ecological characteristic that is related to the wildlife. And with all of this, so the FETP that accept the vet would be only focusing on the something of the sector relevant to the public health, especially the interface. Is that, do you agree with this statement? Can I go to Dr. Chuleeporn first?
Yes, I do. And as I was involved and have been still involved with FETP for 25 years to be exact, and also I saw FETP-V in Thailand since birth, I like to emphasize that it's really a good and correct decision to establish FETP-V in Thailand. If you want to change something, you have to change it from inside. FETP-V situated in DLD, and the people who run it, the one who come to training, the trainers, they are the results from the DLD, and it's pretty sustained, and it's add more of the results of the impact to be true. I like to encourage other programs, other countries to train. Also, if you haven't had veterinarians in your program, please recruit them in. For me, it's really fun, and I learn a lot. And most of all, I appreciate being a medical doctor for human, because they are so difficult. They have to deal with animal life, they have to deal with the economy. It's really difficult. It's similar to when I travel internationally. I appreciate Thailand more.
Thank you. Dr. Xu?
I agree with we need to separate the program for human animal health. I think the two main reasons is because the animal population is more than the human population. Probably they get more disease, a lot of different challenges for the animal health, I think. So they need they have their own curriculum, their different specific practice to become a good veterinarian. The second thing, it depends upon the structure of social society. Because in China, with a big country, we have different systems. The animal health be part of the agriculture, Ministry of Agriculture. The human health be part of the National Health and Family Planning Commission. We have a different system or different level of system. It's complicated to integrate the program. But I think we need to work together closely because a lot of zoonosis outbreak, we should work together to deal with the challenge. Also, maybe some emergent disease will come out from the animal. We need share information, joint investigation to accomplish to protect people's health, animal health. Okay, thanks.
Would all of you agree with me that, maybe we can work this way? We don't need a separate programs, but we need a specialized program for individual sector. And all of these specialized programs need to be linked in order to get to the One Health approach, in order to see the real multidisciplinary linkage or the approach. Is that what you meant a while ago? Okay.
I agree with you.
It seems there's only one person agree. Okay, my last question here. I would put this question to, I think what I have to call is kind of the big sister or the big brother of the FETP or FETP-like program in the country. Let's have this scenario. If there is the disease reported in human, and that disease is potential to be zoonosis or linked to livestock, or even maybe wildlife can be the reservoir. From your end, how could you reach out to your brothers, sister? Okay, you too, Dr. Xu, as you are the FETP program in Thailand and in China, and you deal with the human case reported. How can you reach out to your brother and sister program? Dr. Chuleeporn, please.
Very easy question. So I will call Karun. Or I can also lie him. I can take him everything for that. Tell me the knowledge about this one and tell me the situation and give me a little bit of clue. How should I approach and contact with your people in the province? So thank you for very easy question.
That's all?
Everything. He's my everything in terms of the
So
involved animal. And then also, I have also some students, other in the province. If he doesn't reply my line, and then I can also call Dr. Burkit and Dr. Stone. There's also many people in the province.
Do you call Dr. Baripat as well?
I call Karun as well.
Okay. Dr. Xu, do you call Dr. Kang? You do. What would you, China is big country, right? And you mentioned that you have 400 trainees. Until now, you have about 2,000 graduates, or only 400? 200. For the local. Okay. In this case, how could you reach out to the veterinary, or do you think the China FETPV network would be useful for Ministry of Health in China to deal with the disease reported in human with the zoonotic nature? Do you think it will be useful? It will be helpful?
Very useful at CFPP. We actually work very closely. We share information. We have some joint calls. We want to have more joint field work, but now it's, to tell the truth, it's kind of difficult. So we try to have more efforts in the area, like some training course in the local level, frontline FDP. That may be easy to work together because they face the real problem in the local level. But from up level, it's difficult to go out in the field quickly together. This kind of difficult.
Okay, good. Thank you. Now, yes?
Let me add a little bit more serious answer. Actually, if it's my students, so I ask them to go to the web and Thailand, thairebi.net, this and that. The DLD prepare surveillance database, also accessible through the internet. And other things is the system though, because I don't know if Karun is not there. I mean, if he's moved, then it'd be better if we have the program there or the policy that we can also reach out. For example, we can send the request up to our DG and request some more information. That can also go down to the FETPV program. So I believe in many communication methods that we can do when we are in the crisis. Then we need all means to help.
Thank you. Yes, Dr. Baripat?
I just wanted to share the Thailand example a little bit more. I think in Thailand we are very lucky. All the high level actually facilitate working together. We have interministerial MOUs, we've got interdepartmental MOU, and we have the FETP alumni network and SRRT network that our big brother, the Department of Disease Control, Bureau of Epidemiology is now coordinating. So we take advantage of that system. For example, there was an outbreak in the civet cat farms. And of course, we are thinking it could be a zoonotic disease. So we alerted FETP systems, and then the FETP Central initiate a mission to the provincial mechanism, and we jointly investigate the outbreak of that wildlife die-off together. It is also included the livestock sector. Second example is there was an outbreak in the wild cattle, very dangerous big animals in the forest. And we're trying to target what caused the outbreak and what caused the death of that wildlife species. So our wildlife sector actually called the livestock sector. We assembled a team of 50 people camping in the forest together for 1 week. We only captured 2 animals, but we've got a whole laboratory team. We got an FMD expert, OIE reference laboratory team camping together. Once we capture the animal, we take the sample, we send it back to the lab. So the collaboration goes pretty well if we know where to target. But again, it's a layers and hierarchy of collaboration that we need to make sure that always the green lights, not the red lights.
Thank you. You do anything else? Otherwise, I'll give opportunity to the audience to maybe share their views and ask questions. Are you ready to take questions? Okay, they are ready to take questions. I can perhaps allow maximum of 2. Is that all right, the organizer? 2 questions that I can entertain. Raise your hands, please, if you would like to ask. I'll count 1, 2, 3. Then there is no question. 1, 2, 3. Wow, there is no question. Oh, there is, Dr. Prasakam.
Thank you very much, Dr. Wantanee and Flo. I think the whole society will be benefit from the synergy of the three programs, that is FETP, FETPV, and FETPW. I think Dr. Boripat mentioned a little bit about how to work together under some mechanism. I think, is there any suggestion for the future, for the more formal collaboration between animal health, human health, and wildlife to become more synergy, and then we can benefit more for the health security as a whole?
Okay, the question from the floor is how can the animal health, the human health, and the wildlife health can work together? I mean, even improve than what we have at the moment. How do you have any suggestion, anything that?
I think it's a very good question for how to maintain the good collaboration. And I think the keyword is coordination. And in Thailand, again, we have to thank Department of Disease Control, Bureau of Epidemiology, and Bureau of EIDs that establish, with the help of US CDC, the Thai One Health coordinating units that would serve as the body to coordinate things around agencies. I think I would suggest that the Department of Disease Control bump up this capacity. Maybe we can rotate the staff from the multi-sectors to be stationed there. Maybe there's some staff seconded from DLD, some staff seconded from the wildlife sector in terms of the EOC platform that you can actually coordinate things timely. I would love to see more resources invested in that coordinating body, and I would love to see more facilitation, more dialogues, more regular meetings, not just meeting each other once a year in conference like this. So if you can establish a routine, a normal route of collaboration, communication, I would think things would go much smoother.
I think what I learned from the some technical issue it is when I learned social network analysis. One of the things that I learned and I think we can apply to strengthen the network is if you have more and more network, more linkage to each other, it means that the linkage and the network will be more sustained. So in both formal and informal way, there are a lot of examples when we train people, after they go back to their own responsibility, they create a network with others. And then there are a lot of nodes to distribute and to strengthen the network, so that the network will be strengthened and strengthened by this way.
For me, I do think that if you want to reach out to other people or other sector, yourself have to be stable. For the Thai program, from 38 years history, we are pretty stable and even expanding. But for the V program, I feel like they still, even though it's how many years? 8, almost 10 years. But in terms of expanding inside themselves, that if it's more stable here and then we have regular communication like Dr. Boripat said, then the networking, the talking will be pretty smooth.
Okay, thank you.
Everybody knows in the animal health and the human health work together very important for the health. But how? I think an important way, acceptable way for the different stakeholders is training staff first. Then let the professional, the technical staff know each other, understand each other. Then we try to have a more opportunity in the work in the field, work together, even for the small field work, to show the evidence. If we work together, we save money, we save economic, we save people's life. We won't want to waste money, waste time. So it shows evidence to the politician, to the government, maybe the effective way to push the two departments work together. That's my opinion. Thanks.
From my opinion, I think, how to see, there are 4 capacities we must be built before we have the collaborations. First one is we must need the share information first. So everyone can know each other's data and information, and we can do analysis before. The second one, I think we must use the same protocols. Like we use epidemiology thinkings, and we have the standard diagnostic standard. Yes, we can detect the disease in the eco levels. And we can use epi tools in the same ways. So we can analyze the data in coincidence. And the third one, I think we must, understand the different part from the animal health or from the public health, because different departments have different ideas, and they must design and formulate their strategies. So if we can understand their meanings in the previous, I think we can do the collaborations in the future. And the third one, I think we must have the open-minded attitude, and we can do the deep cooperations, not in the stage of the attitude, but on the stage of the real actions and the real activities. This is my opinion. Yeah, thank you.
Wow, okay. Thank you very much. Dr. Pasakon, thank you so much for the question. And I think, we can treat that this question is 2 questions, okay? This is quite good. What I like to say, I think 3 key messages from this session. Number one, lots of them, it's pretty sure that each sector, in order to work together as the one team, one health, we have to have the same level or similar level of the capacities. So specialized training would be very good. This training program, this specialized capacity building program is good. However, this specialized program we need to link together. And this is the opportunity to build capacity for individual, and also opportunity to build up the network. This network, especially you come from different sectors with different thinking, different system, different communication. We have to start, and this is an opportunity that when the programs are linked, they know each other, they call each other, and you call it informal way of the communication. And this is the trust that can be built within this informal network. You understand the person, you understand individual. So this is the key thing on the second message that I would like to give out. You have capacity, you use this capacity building program to build trust. To be more sustained, with 2, if Dr. Karun or anyone resigned, we don't know who to call in DLD. Then, to be more sustainable, we need to build up the system. And I believe that is the institutional capacity building. We need to have the kind of a more robust of the communication platform. We need to have the harmonized system that we can agree it's going to be for One Health. And we need to maybe build up the case, the example of how we can operationalize it. So with these 3 key things, I believe this is really the One Health opportunity, and we have the network within that opportunity. And again, to all of you, One Health is definitely, there is no question, it is the approach that we need to use the multidisciplinary, multisectoral coordination and collaboration to deal with the complicated public health threats. I would like to use this opportunity again to advocate that public health consists of not only human health, but also animal health, wildlife health, ecological health, environmental health, and other. So this is all why we have all of them, and I hope this message would be brought back by all of you in your real work and real world. Thank you so much. I would like to thank all of you. Thank you. Thank you so much for staying with us, and hope you enjoy the field trip today. Thank you.
Yes, again, I would like to thank you, speaker, for sharing your program experience and show us an example and a good recommendation for our lateral collaboration in outbreak investigation. I think all of you may have a decision to join us. Whatever program or wherever you learn, please be our family.